Dear audience, dear colleagues, dear chairs, good morning, and thank you to let me introduce my PhD thesis about the novel treatment of advanced urothelial cancer. My name is Mohammed Altenni, and I'm working at a Péterfi hospital as a urologist. My supervisor, Tibor Szarvas, and my SMS, Jakub Hoferica. My statistician, Péter Fehérvári, and Mikolt Bakony. I have a mission to provide outstanding clinical treatment for patients with advanced urothelial cancer in a strong academic environment. My vision to serve bladder cancer patients with compassion, professionalism, integrity, and excellence. According to this, I have two ongoing specific goals, both of them about the same disease with a different kind of novel treatment. First project is identifying patients who would benefit from enfortumab vedotin in advanced urothelial cancer. A little bit about the background here, that 5-year survival for metastatic urothelial cancer is very poor. It's around 5%. Advanced urothelial cancer patients are undertreated, especially in the third-line setting. Less than 10% will receive the third-line therapy. And according to the EV301 randomized trial, which is conducted, which is approved the use of enfortumab vedotin in 2021 as a third-line therapy because of the superiority than the chemotherapy in the same setting. As we can see here, the overall survival is higher, and the objective response rate is around 40%. The problem is, in a randomized control trial, patient selection is very strict, and in the real world, we have a less selected population. So our aim from this study to identify which patient with advanced urothelial cancer will benefit more from the treatment. Our clinical question, how do different clinical parameters impact the outcomes of EV-treated advanced urothelial cancer patients? We used a PECO framework, and our population patient with advanced urothelial cancer treated with enfortumab vedotin. We are comparing different patient characteristics and our main outcomes: overall survival, progression-free survival, and radiographic response. We hypothesize that enfortumab vedotin provides greater benefit to advanced urothelial cancer patients with specific characteristics. We conducted our systematic search in 3 main databases, and we used the search key you can see below. We got more than 1,600 articles, and after the selection procedure, we got 23 articles. Here, I would like to present our results. So our first figure about the pooled objective response rate between prospective and retrospective studies. As we can see here, and it is an interesting that in a prospective studies, the proportion of response is 0.44. That means 44% of patients have a response. And in a retrospective studies, which is the patient are less selected, we have a higher response rate than randomized trial. So now I would like to go deeply between patient characteristics. So we can say our first plot, we are measuring the objective response rate, the odds ratio of objective response rate in patients previously treated with immune checkpoint inhibitors. We are comparing the responders to previous therapy with non-responders. And as you can see here, we have 6 studies, and the pooled odds ratio is 1.51. That means patients who previously responded to immune checkpoint inhibitors have a higher response, 50% higher response than patients who not responded. This outcome mathematically is significant and clinically relevant. Second, first plot about the ECOG performance status, and we are comparing the objective response rate, overall survival, and progression-free survival between ECOG 0 and 1 and ECOG higher than 1. And it's not surprising us that patients who have a favorable ECOG status have a higher response and higher survival rate. This is our third forest plot and we are comparing the tumor location between upper tumor and lower tumor. and we didn't find any difference between the overall survival and progression-free survival. Here is the composite of our overall survival among all studied characteristics of EV-treated patients. And as we can see, we have 3 statistically significant and clinically relevant outcomes, and the other outcomes might be clinically relevant. And this is the composite of the objective response rate among all characteristics of EV-treated patients. And this is the summary of progression-free survival from our results. Our first project manuscript status, we would like to submit it at the end of this month. And we choose the European Urology and Oncology. We have a strength of our study that this is the first systematic review and meta-analysis. And we have a large sample size. And the limitation of our study that we just have a univariable analysis, and our patient-level data unavailable for all studies. And we have a limited number of studies which is investigated the molecular outcomes. So our conclusion here that patients with certain parameters like favorable ECOG status and patient responded to previous chemo and immunotherapy should be prioritized to EV therapy. We have our implication for practice that enfortumab vedotin is more effective in chemo and immune checkpoint inhibitors responders, and the FGFR status might influence the efficacy of enfortumab vedotin. Our implication for research that the background of differential efficacy of enfortumab vedotin between various characteristics should be evaluated, and enfortumab vedotin may be used earlier than the third-line setting. So let's move to my second project, which is identifying patients who would benefit from immune checkpoint inhibitors in advanced urothelial cancer. The background here that immune checkpoint inhibitors are also novel treatment from 2017. But unfortunately, 25% of those patients will benefit from this therapy and 75% will not. So our aim from the study to identify which clinical parameters are associated with better response to immune checkpoint inhibitors. With the clinical question, how different clinical parameters impact the outcomes of immune checkpoint inhibitors treated advanced urothelial cancer patients, and with the same PECO framework, our population patient with advanced urothelial cancer treated with immune checkpoint inhibitors, and we are comparing different patient characteristics with the same 3 main outcomes. We hypothesize that immune checkpoint inhibitors provides greater benefit to advanced urothelial cancer patients with specific clinical parameters. We conducted a preliminary search, and we got more than 6,000 articles. Here we are showing the 3 main key articles. The most important one of them conducted by Melinda Varadi from Semmelweis Urology Clinic at the end of the last year. To sum up, we have 2 ongoing specific goals, both of them about the same disease with a different kind of a novel treatment, and we would like to focus on the first project that now we would like to submit at the end of June or the 1st of July. Thank you for your attention. My favorite quote, be brave to stand for what you believe in, even if you stand alone.
Congratulations to your presentation. You listed among the weaknesses that the molecular analysis is not available in a wide range. What kind of molecular markers do you focus in your next search, if you will continue on this topic?
If we would like to focus on FGF, fibroblast growth factor receptor, and for the second project, especially for the PD-1 and PD-L1 inhibitors. So this is the main two biomarkers what we would like to investigate. Thank you.